This breakdown, I'm going to be covering headaches, and they're very common, but they usually can be like hit or miss if they're actually a soft tissue or musculoskeletal component causing all that dysfunction. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that focuses on working smarter, not harder, allowing them to make well over $100,000 per year with less than 20 hours of time per week in the clinic. Breakdown this week, I wanted to share an older video I made a couple of years back about the idea of trying to figure out if headaches are actually caused by a soft tissue component or a musculoskeletal component. Headaches are so common and they plague society, and a lot of people go to conservative care practitioners to try to get their headaches figured out. And a lot of times we just jump right in and think that we're going to be able to solve it, and they end up being a lot more frustrating. So I'm going to include a couple things in this week's breakdown. The first is just going to kind of give you an intro to the idea of like, is this actually going to be something that's going to work for a soft tissue conservative care type of approach? How that client actually presents with their headaches, what it feels like, where they're feeling it, so you can really know if you're going to be able to have a home run to be able to go in there and fix those headaches. And then secondly, a lot of the problems that I end up seeing for headaches, especially migraine dysfunction, is going to be in the suboccipital triangle, specifically rectus capitis posterior major and rectus capitis posterior minor. A lot of times people have trouble finding them, so I'm going to show a detailed palpation video going through how to find those with landmarks, so that if you do have a soft tissue component that will respond to manual treatment, this will be a slam dunk for you. So the first video is going to be me just giving an idea of like if that client will actually respond to conservative care. So let's check that one out first. I want to talk today about that rabbit hole of chasing headaches. You know, everybody's got headaches, you know, and we tend to put that front and center for our marketing and how we communicate effectively with the patient, like, hey, get rid of headaches. But headaches are so multifactorial, and a lot of headaches are actually not a musculoskeletal problem. And a lot of us make this mistake of trying to go in on trying to fix the headache, and we didn't collect enough data. You know, I talked about this in a video that I shared in marketing yesterday, talking about a lot of the headache symptoms are just factors of dehydration, stress, things like that. But a lot of people seek out conservative care trying to find an answer for their headaches. And we want to help them as well, but we don't collect enough data on the front end of that patient. And then we start down this journey of treating headaches. And the thing is, there isn't a musculoskeletal component to that. So one thing that I always tell people, and when I ask questions, is when you get headaches and you get that tension headache, do you also get neck pain associated with that? And that's a really important question to ask the patient. And a lot of us don't do that. And we don't put that correlation together. Now, if a patient says, yeah, every time before I get that headache or that tension, my neck starts to hurt before, I'm like, yes, perfect. You're in the right place. Because now I know that there's a musculoskeletal component there. But when people start saying, you know, I don't really get neck pain, but I get headaches as well, and they tend to be more of a stress-related component. These are the people that are like fine all week, and then as soon as they get back in their office at their desk, they're like, oh, I get a headache again. And then we find ourselves kind of chasing this rabbit and being like, what is it? What is the components associated with that? And we keep doing more and more treatment. We work all the muscles, we work all the scar tissue in there, but the headaches just really aren't improving, or if they are improving, they're not really lasting. And then people become more and more frustrated with it, especially us as the practitioners. Like, we want these people to be better, but what happened was we missed that component. You must have a neck pain related symptom as well as the headache if it's going to respond to conservative care. That's just the facts. That's not me making up anything. It's just the facts. But so many people are stressed. They have really lousy posture. They have horrible diets. And a lot of their problems are coming directly from dehydration. And the beauty of dehydration is you can fix it with more water. But I've been down this path with people, and I went down that road of trying to fix migraines, trying to fix headaches, and it's a never-ending battle. It's like you get your head above water and then you're right back to where you are, especially if it's not a musculoskeletal problem. Now, if we're in luck and it is a musculoskeletal problem, the chances of that headache being caused by one of three things, if not a combination of all, is very important, and it's going to cause us to get way better outcomes. And these are the people we want to have. These are the ones that come in, man, I got headaches, my neck hurts all the time. We're like, yes, I'm going to be able to fix that, and I know I'm confident. And the first problem you're going to find with that is getting in on these deep suboccipital muscles, specifically rectus capitis posterior major and rectus capitis posterior minor. Minor is the biggest problem that we're going to find in a lot of those headache type related things and neck pain. The problem with minor is it's really hard to get to because it sits so deep. It's right at the very base of the skull, and it's between the occiput and then the posterior arch of C1. And it's deep to a lot of things. It's deep to the trap, deep to splenius capitis, deep to all the deep cervical muscles. And it's hard to get to, but if you can get to it and you do it just right, and if you haven't watched that video, go back and watch the advanced palpation of the upper cervical muscles. And so we got through that upper cervical test and went through everything. Now we want to get into more of an advanced palpation of the suboccipital muscles. This area is very problematic for so many people with bad postures, headaches, tension, everything like that. The problem is the muscles are really deep and a lot of practitioners aren't able to get an effective treatment. So the two muscles I'm going to be demonstrating today are going to be rectus capitis posterior minor that goes through here, and then rectus capitis posterior major that goes through here. Now these muscles are as deep as it goes, and there's a lot of things that you work through. So a lot of times when practitioners are working these muscles, they're actually working like the trap, semispinalis capitis, cervicis, splenius capitis. They're actually not able to get on there and get deep where it needs to be because these muscles are deep and you got to work through a lot of tissue. So I'm going to demonstrate a couple tricks, a couple methods to get in there and do that. So we start, a really good way to get this is we start by having the patient actually come to the edge of the table here and have their head and their shoulders and T-spine rest right there. And what that does is it really allows this area to open up and give me access to everything like that without a lot of that tension. If we do it laying down on the table, we're gonna have to work through the trap, work through a lot of those things. So what I do to start is I bring the head back in just a little bit of extension. And the key on these muscles is landmarking the areas where you need to find it. So we're gonna check rectus capitis posterior major first. And it goes from the spinous of C2 all the way up to the occiput. And it kind of goes at like a 45-degree angle. So what I do first is I find that C2 spinous. It's pretty easy to find. And then what I do is I pick up my finger and go just a little bit lateral. Now I know I'm there because I landmarked it. And in order to get the depth that you need on it, a trick that I like to do is I take this bottom leg here and I put my arm right up against it. And then what I do is I slowly drop my body in. And that allows me to get some leverage. It's almost like I'm a fulcrum as I go up through there. So if you're struggling getting onto these muscles, get a little bit of extension and then drop in like that. And you should be able to, when it's done right, to hang out there all day. And it's a really easy contraction and my hands aren't getting tired at all. Now, the next muscle, rectus capitis posterior minor, these muscles are a wreck on pretty much anyone that comes in for a neck problem. Problem is they're really deep and most people can't get to them. So this one takes a little bit more finesse as we go in there. So same thing that I did here. I have my index finger on C2, and then what I do is take my middle finger and that goes on the posterior arch of C1. So now what I'm able to do is take my index finger and replace it on my middle finger there. And what that does is it really opens that area up. Get that extension again, and a little trick here is to get a little bit of slight lateral flexion towards. That gets that semispinalis out of the way and some of that upper trap. Now, what I'm able to do is go just a little bit lateral because it sits right up against that posterior arch. And what I'm able to do is I get some depth by leaning in, and then a little trick I do here is once I'm in there, I pull my finger lateral just a bit, and then I get depth again. And when I'm on there, it really opens up that muscle. So essentially what we do is we sink in, then we do a little pull with that finger to pull that semispinalis out of the way, and then I get another depth. So it's almost at 2 leans. I go here, pull, lean again, and then you're able to get in there really deep and really focus on that area, because these muscles are completely misdiagnosed, mistreated out there because people can't get to it. So using your body as leverage, sinking in, bowing things out of the way, and taking your time can make a big difference in accurately palpating those.
And when you're on it and you hit it just right and you tension it and you get into it, that patient's going to be like, oh shit, you're on it. That's the spot. That's the one that I need. But nobody's really effectively treating that. So if you've done all the headache treatments and all those things, first question and first thing to always do, as we talked about, was make sure they have a neck pain related thing for that, and it's correlated with the headaches. If they don't have that, then you don't want to treat that, because it's going to be a never-ending battle. It's more of a stress-related dietary dehydration type of thing. And getting that information up front allows you to better future pace how they're going to do, because nothing's worse, and we've all been there. Nothing is worse than taking a patient through a bunch of treatment, they pay a bunch of money, and you didn't help them at all. That sucks. That sucks for the patient, and it sucks more for us too. But if you do it right, you screen the people properly, and you get the right type of treatment for what they need, it can make your practice and your business just thrive and go to another level. The other issue you can have, especially with headache-related components and neck pain, could just be some degeneration in there, specifically to the disc. You know, you see that in the joint, you see that in the disc as well, and degenerative components build up. A lot of times disc injuries and things like that will pick up, and you'll pick that up a lot more in the history and what you do. But what it comes back to is the idea of collecting data, taking a history, and people aren't willing to do that. We're not taught this as much in school. It's just like going through the check boxes, like boom, 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 fill out this form and go from there. But really dialing in with the patient and finding out the things that you need to do are going to set you apart. And collecting that data and having that data, interpreting the data and making that right is going to set you apart from everyone else, and you become that solution provider that we all talked about.
So the take home from this week's breakdown has a couple factors to it. Number one is, don't just start jumping into treatment right away. You know, so many of us as manual practitioners just want to jump right into the treatment. We really have them kind of fill out like a bullshit intake form. We really don't start to think critically, like ask the right questions, be able to thoroughly figure out what's going on and really start thinking critically. Two, load management of clients. You know, so many clients come in and they come with their problem. They say, here's the problem that I started and here's the fire that I started, you put it out. And then they do a bunch of stupid shit in between, and they're doing a lot more. So a big part of your treatment process is communicating effectively about how they need to cut back. They need to do their work outside of the treatment itself. They have to participate in the treatment. And a lot of times people that are having these headaches that are a musculoskeletal component, they're just doing too much and they're exceeding their capacity because they're doing too much load. So having that conversation will really help. 3, communicate effectively. Communication is everything. You know, so much of us struggle with getting the client to see the process all the way through, but we don't really do a good job of explaining exactly what we're doing, why we're doing it, what we're doing, and what they need to do in between. It has to be a team type of effort. And if you're just going in there and treating it and then send them off to go do everything else throughout the week, and they're coming back and they're still having headaches, there's a load management component in there. There's a lack in communication. So making sure that you help them understand that they need to participate in the treatment and give them the real tactics and tools they need to do to make sure that they get this fixed for good. I got for the video. Hope you got something out of it. If you liked the video, give it a comment, a like, or share. If you have any topics you want me to cover specifically, send them over my way. I'm happy to help. Go grab our free training. Come take one of our courses with us here in 2022. And lastly, just get on that path to start thinking critically. We have that in our free training. It'll take you to a different level from everyone else on the process of becoming a solutions provider. Appreciate you guys watching. I'll see you on the next one. Bye.